To apply the ulnar gutter, you'll first need to determine the correct splint width. Take the circumference of the patient's PIP joints on the 4th and 5th fingers with a measuring tape or a ProCare elastic bandage. The circumference should approximately match the width of the splint. To confirm the accurate length of the splint, use a measuring tape, ProCare elastic bandage, or Exos Rapid splint to measure from the tip of the 5th finger to approximately 2 inches from the elbow crease. Before you apply the Exos Rapid Splint Ulnar Gutter, it's necessary to heat the splint. First, make sure the splint warmer is completely closed. Then, take the Exos Rapid Splint from its package and remove the foam padding if applicable. Slide the splint into the open end of the splint warmer. Leave about 2 inches of the splint exposed. Attach the hook wand to the exposed end of the splint and slide the splint all the way into the splint warmer. To begin heating the splint, plug in the splint warmer. Allow the splint to heat for about 5 to 7 minutes. After you've heated the Exos Rapid splint, remove the splint from the warmer. Please note adjustments can be made to the splint prior to heating or post-heating if necessary. Trimmed edges should be rounded. Reapply the foam padding if applicable, and ensure padding extends beyond the edges of the splint. Trim the pad if needed. Put a light longitudinal fold in the splint, and drape the splint on the ulnar side from the tip of the 5th finger to the forearm. Ask the patient to hold the splint in place while you apply the ProCare elastic bandage. Start by securing the splint with 2 wraps around the patient's wrist. Continue by wrapping over their hand and twice around their 4th and 5th fingers. Finish by wrapping proximally to secure the entire splint. Be sure the medial borders of the splint do not create pressure on the digits. Mold the Exos Rapid splint as prescribed by the patient's physician. In the typical splinted position, the patient's wrist should be in 20 to 30 degrees of extension, and their fingers down so their 4th and 5th MP joints are between 45 and 90 degrees. Use moderate elastic bandage tension, more than you would with fiberglass or plaster splints, to ensure good molding. Add shape and contour to the Exos Rapid splint by molding with your palms. This significantly increases the final strength and rigidity of the splint and reduces setup time. If the final position of the splint is not ideal, remove the elastic bandage, place the Exos Rapid splint back into the warmer, and repeat the application process. With standard heating time, overall hands-off rigidity should be achieved in approximately 3 to 5 minutes, while full rigidity will be achieved in about 10 to 15 minutes.